Hello, everybody. Thank you for being here on this April Fool's Day. I want to wish niece Ellison Ray McMahon a happy birthday. One of the best April Fool's presents we ever got in our household. But today is also an important day as we talk about the census and some of the rollout. The census is a critical process to our community, and now many people have some time on their hands. They're looking for things to do. We need to get you to participate in the census. So saying that, I want to welcome Mayor Walsh, who has some comments on this topic. Mayor?
Thank you, County Executive. So earlier today, the County Executive and I made history. We issued our first e-proclamation at our first WebEx press conference, but on a very important topic. Today, April 1st, is Census Day in Syracuse and Onondaga County and the entire country. And the current COVID-19 pandemic literally gives us a life and death example of how important the census is. So many of the resources that we're turning to now to help people, whether it's feeding our young people, helping our homeless population, so much of that comes from the federal government. And the way in which the federal government determines how much of its resources is allocated is based on population. Look no further than the most recent stimulus package. Cities with populations of 500,000 or more received direct aid through the stimulus package. Now, thankfully, despite the fact that Syracuse is well below that number, we still did receive funding through the Community Development Block Grant program and a few others. But again, our population drives so much of our federal resources, and that is why we need to have an accurate count. People ask me every day, what can I do to help during this crisis? What can I do to help people? I feel so helpless. What every one of you can do, whether you're a member of the media sitting in this room or you're a resident of the city of Syracuse or Onondaga County sitting at home, you can fill out your census right now. It literally takes 10 minutes max. I did it a few weeks ago and did it in probably less than 10 minutes. You should have received a mailer at this point, which gives you an access code to go online. The website is 2020census.gov. You punch in that access code, you log in, you go through a series of questions. Again, you're done in likely less than 10 minutes. I've not only received my first mailer, I've received a reminder. So many of you have received that reminder as well. Again, don't wait any longer. This is a way that you can help right now to make sure that our community has all the resources it needs to fight against this pandemic and literally save lives. If you have not received the mailer or you don't have access to the internet, you can do it by phone. The number is 1-844-330-2020. Worst case, you can wait until the questionnaire is mailed to you, but again, don't wait. If you can help it, if you have extra time on your hands, do it right now. Literally, lives are depending on it, and there is no better way that you can help all of us than by doing just that. Thank you very much.
Thank you, Mayor. This is one of the things that the county and city have been working very, very well together on. Put together a task force very early on with the Community Foundation and other partners, and the data kind of reflects that coordination so far. I think over 40% countywide participation to date. That's ahead of the state average. Over 30% from the city of Syracuse specifically. That's ahead of schedule too when you consider some of the parts of the city that haven't really factored in yet, the university neighborhoods where a lot of our students are. So those teams are doing great work, one of the many areas that your local governments work together every day on. So let's get into some of the numbers. We currently have 277 cases. That's up from 249 yesterday, 28 new cases. 27 individuals are in the hospital. 14 individuals are critical. Sobering data. If you look at, we see people coming into the hospital as their illness progresses, and now we see more people getting very sick. Certainly, any patient who is in critical condition is in ICU, and they are in a fight. So let's remember our neighbors and pray for them and their families. 6 people were released from the hospital since yesterday. That's some good news. And today there are 67 people who have recovered and are released from mandatory isolation and quarantine. So for those who maybe be just tuning in today, we will always talk about the positive cases. Once you're a positive case, you're always a positive case. But we also talk about the recoveries, and then the new curve that we're looking at is our active cases. Those are people who have yet to be recovered but are still positive. So right now we are presently monitoring 209 active cases. Of those who are hospitalized, every decade is represented except those under 20. 25 of our 277 positive cases are considered contact cases. These are individuals that most likely from the same household as a positive, and they have now tested positive for COVID-19. From the total cases, 156 are female, 121 are male. 8 are under 19. 60 are in their 20s, 42 in their 30s, 43 in their 40s, 49 in their 50s, 40 in their 60s, 23 in their 70s, 10 in their 80s, and 2 in their 90s. 25% of our positive cases are under the age of 30. 40% are under the age of 40. 55% are under 50. 73% are under 60. And 27% are over 60. Geographic breakdowns: 87, City of Syracuse; 29, Clay; 21, Salina; 20, Camillus; 19, DeWitt; 18, Cicero; 15, Onondaga; 14, Manlius; 13, Pompey; 10, Geddes; 9, Lysander; 6, Skaneateles; 4, Van Buren; 3, Lafayette; 3, Atisco; 2, Marcellus; 2, Tully; 1, Fabius; and 1, Spafford. Geographically looking at that, the disease, COVID-19 virus, is every part of our county. No real trends other than that it doesn't matter where you live, people in your community have the virus. Testing. So far there has been 3,779 tests. That we've been doing robust testing. That number is larger than many counties that are larger than us. We've had 277 positives. 3,502 negatives have been reported. We received 372 tests back since yesterday and have roughly 480 pending tests going into today. Our data remained the same. About 7.2 to 7.3% of those tests that have been done are testing positive. A reminder, after a positive test, our health department will contact you and check on your health and gather information about direct contacts since the onset of your symptoms. Your primary care provider or your doctor will also be contacting you. This is how our health department knows who goes into quarantine because of direct exposure. Direct exposure is just that, direct exposure to someone who is sick, and it is not someone who went shopping at the same store on the same day. It is someone who we believe you've had direct exposure with, certainly family members, people you live with, and through our investigation looking at employment, et cetera, et cetera. As a reminder, we did this early on, and it has proven to be very good. Anyone who has been tested must stay in a quarantine until the test results are back. That is the law. So if you get tested, you go home, you wait for your results. On average, they are now 24 to 48 hours. Again, that doesn't mean they won't come back faster or a little bit longer than that. That is an average. Because we have community spread, every person should be monitoring their health every day and their symptoms every day. If you feel sick, you feel symptomatic of some of the symptoms that you're learning about, call your doctor. Certainly, we don't want someone to get sick and get COVID-19 and have an opportunity to spread it to others because they didn't call their doctor and go and get a test. We have testing. I can't say enough and we'll continue to say this. If you're sick, stay home. If you're an essential employee, essential worker, please keep your children home. And if you have any symptoms, please call your doctor. Once again, tips. We're always getting calls now related to many media reports. The employer gets a positive case. They're putting out a report to their employees because they want to be proactive. They want to deal with fear. We're now getting people calling us up based off media reports, screaming at my health department. We talked about this earlier. We explain to you when we alert things. Do not call the health department yelling at them. They need to be working on cases, not dealing with people yelling at them, because we're not calling everybody that could have shopped at a grocery store on a certain day. This is common sense. There's no 100% risk mitigation in this process. If there was, we wouldn't be in the situation we are with an outbreak of this virus throughout the world. So please be respectful to our health department. They are your public health officials fighting for you on a daily basis. This is going to be uncomfortable. It is uncomfortable. You're going to hear about reports of an employee who worked somewhere. I'm never going to confirm a report of an employee that is positive. I don't have that information. The health department does. You will hear from us, being the public, if there is a gap in our investigation and we believe that the public may be at risk in this process, we will then come forward. You will hear about different employers that go out and talk about this, because if you can imagine the rumor mill, if you work somewhere and somebody gets tested positive, if the employer doesn't address that, that's why they're doing what they're doing, and that's why we work with employers on what their messaging should be. But again, an example, there was a report on Centro. We were looking at that case. Centro puts out a report about it, talks about it. Through our health department investigation, we deemed that there was no contact with individuals. People are coming in the back of the bus. They weren't coming in the front of the bus by the driver. But Centro worked with us. They put a report out to the public, even though we deemed that there was no potential contacts there with the public. Certainly, people that may have been in the investigation during that process that they work with, that's a different ball game. Those people are probably already in a quarantine situation. But I'm asking for the public's help and patience on this. Our health department is busy. They're busy taking care of sick people. They're busy investigating. They're busy working out ways to get people out of a quarantine situation, to get people who are positive, who are recovered, to get them into a situation where they can be released from isolation. We are sharing all the pertinent information with you, and we will continue to be sharing all the information with you. We work for you. Again, related to other release from home isolation now and other information, I want Dr. Gupta to come up and give us a briefing. Doctor?
Good afternoon. Thank you. So I think I have been talking about for the last few days regarding the people coming off from isolation and quarantine. Just a reminder, isolation is for the cases and quarantine is for the contacts. Those are not sick yet, but they can become sick. So we have talked quite a bit in length in the last few days. What I will just remind in a brief way, isolation, you have to have 3 criteria to get off the isolation: fever-free for 3 days or 72 hours, 7 days symptom-free, or since the onset of the symptoms, and you have to have a continuation of improvement of symptoms. For asymptomatic cases, when they are COVID positive, we have to take their onset exposure at the day of testing, and we take 7 days from there. And why I am bringing up today this one here, because we don't know a lot about asymptomatic people, how they actually transmit the disease. And when we are talking a bit about community transmission, it is so important for us to think that what we are doing today, if our cases continue to increase, there's something more to the picture. So when we are putting all these data is not just to put it out there. Data is to inform people that you really need to follow social distancing. staying home, not to go to have more than large group of gatherings. All these things are going to reduce the path of transmission, so the virus cannot go from one person to the other person to other person. So the time with the asymptomatic, when the person doesn't have symptoms, those who never become symptomatic or those do become symptomatic, what happens before they become symptomatic? The science is still looking at it, and what the social distancing part talks about is try to get into that way. I think it's important for all of us to remember that part, which we are trying to mitigate by making sure that people are following social distancing and the hand washing and staying home when they should be home, actually. Not only when they are sick, they shouldn't be just going out and socializing with 5 different people. The second part which I want to talk about is how do we monitor individuals? The expectation in real world, in an ideal world, I wish we could contact every single person every single day, but the way our cases and number of cases are increasing and number of people are in the quarantine are increasing, it's not humanly possible for us to contact every day like 500 to 600 people, right? It's not feasible. So we prioritize those who are individuals who have underlying medical problems. As we talked about, what underlying problems will be: diabetes, heart disease, lung disease, cancer, obesity, asthma, all those who we feel, or elderly who are living alone, who don't have much resources and may get lost in this path. So our priority is to contact them on a regular basis. However, we want to use the technology to reach out to them. And I did mention something yesterday was texting, and I'll just talk briefly about that, how that works. So New York State's message and monitoring system, that's called NYSMMS. That's a system which is in which what we do is during the investigation, a nurse puts the information together and asks for the mobile number, which we get that information from the patient, and ask their permission if you would like to be enrolled. I wish everybody will get enrolled in that messaging system. Once enrolled, New York State MMS sends the initial text to the patient, which receives, "Thank you for providing your mobile number. As we discussed when you talked with the county health department, NYS MMS would like to monitor you for illness. Do you agree to receive and respond to text messages from NYS MMS?" And they say carrier charges may apply. That's a standard text you will get when you go to doctor's office and they say, reminder. I have received it when I go for my dentist appointment or my primary care or GYN appointment. That's the similar thing here. They're trying to use the technology, and you have to say yes to respond to yes, and people sometimes say no. So I wish people will say yes to that. Why? Because based on your isolation and quarantine time, what we do is that it will go for either 7 days or 14 days. And what it provides us opportunity that we can continue to monitor them with the health commerce system, that a person has a high temperature. So we will find this person and we'll contact them. So this gives us opportunity to screen individuals who we should be contacting, who we otherwise feel they are healthy. So technology does actually play a significant role. What they do, they send the text messages and reminder at least 4 times, and people don't respond. That becomes a little complicated in that situation. So individual has to respond to say yes to that. And I am asking everybody who are cases or are contacts, please work with us. Please participate in this NYSMMS. So it helps us to reach out to you in a very timely manner. And it also improves our efficiency because we want to reach out to those individuals on a daily basis who would want our phone call on a regular basis, some of those who need a lot more resources. And again, just to reiterate the fact that we continue to work through each and every investigation. Those people who work in some place, whether it's a health sector, whether it's a grocery store, whether it's a transit, They all go through the same series of investigation, and we work with the employer, we work with the supervisor, we work with the individuals, their friends and family, try to have the whole picture of how the virus from one person can be transmitted to the other people depending on what the stories we get. And we put all together, and that's how we do the public messaging. That's how our work functions. Thank you.
Thank you, Doctor. Again, and not everybody watches every day, but our strategy was early on as a community to make decisions to build up and maintain our healthcare infrastructure so that when we got to this point, sick people had sick beds and there wasn't a community spread due to people going into the emergency room and spreading it. And many of the things we've done have allowed that. We have done more testing than most communities in New York State when you look at the situation related to how many positive cases we have from a percentage standpoint. We are in a position now where we're almost 24, 48 hours away from real data, and hopefully as the technology and tests come out, we'll be able to get to that point. We want to test, identify positives, identify quarantines, and then we work on recovery with those individuals. But what do we do in between? We have to social distance, and that's what we can do. That's our answer to this. And so our community was graded as a B. We talked about that yesterday. I know many of you tweeted out that. Trish, I think you're doing some great live tweeting yesterday. But when you look at that B as a community based off of cell phone data and how it moves compared, we got to do more. We have to move higher. Many of these new cases, as the health department has started their investigation, they're seeing some trends that these are more not 20 or 30 people hanging out, but maybe 5 to 10 people in a gathering, and that's really something that needs to be taken seriously. We need people to kind of stay home. We need them to have their kids stay home. It's tough. This is very, very tough. As a parent of 3, I understand how tough it is, but we need you to do that. We have to get to a spot where this curve flattens. How we do that is social distance, identify those who are sick, identify those who are at risk. So thank you for that. A couple numbers before we'll take some questions. If you're in a situation where you are symptomatic, you don't have a doctor, you don't have health insurance, please contact the Upstate Triage Hotline, 315-464-3979. Our seniors, healthcare workers, and adult nutrition line, 315-218-1987. That's a line if you are having an issue getting some supplies, getting a meal, you need a meal. If you're a healthcare worker, you can't get to the grocery store and you need some basic supplies due to your shifts, and when you go there, they're out, please let us know, and so we can help you. Again, we've extended our Child Care Solutions daycare program for the month of April for our essential businesses that are open, including our emergency providers and healthcare workers. These are daycare slots that are there for you, 315-446-1220. I want to thank the media for all the reporting you're doing on the PPE, emergency management supplies for our healthcare workers, our first responders. You're starting to see many different people who are working, interacting with the public with the masks, the N95 masks on. There is a shortage. If you have a business and you have some of these, please consider donating them to us. Our number is 315-435-2525. And again, volunteering, our volunteers are one of the great stories throughout this process in our community. Please contact Volunteer CNY, 315-428-2229. And mental health is being challenged every day for all of us. Certainly no one is immune to that. If you need help and you need to talk to somebody and you don't have that help available in your own lives or your own doctors, please consider contacting 211 so that you can talk to some mental health professionals there to help you get through what are really uncharted and unprecedented times. And nobody should be embarrassed if they need help. This is truly unprecedented. Saying that, again, common sense, I got this alerted to me. We apparently, Centro has been free for traveling and for people getting to work. Apparently, some people are taking this to a new level. There's been multiple reports of people using Centro for joyriding. Please don't. You should be traveling if you're going to and from work or to and from the grocery store or pharmacy. No joyriding on the Central buses. Saying that, questions?
I thought you were very clear yesterday. I thought our reporting was clear yesterday about why the health department does and doesn't put out press releases for public spread. But I'm sure your office, I know my newsroom gets constant questions about a case here, a case there. Is it confusing when Centro puts out specific route information, but a company like Wegmans won't put a specific date this employee worked kind of information?
Yeah, I think Centro is a public authority, and we talked to Centro about that, and we just wanted to go the extra mile, I guess, on that situation there, Andrew. We can't tell a private company what to do when we feel we're comfortable with their with our own investigation. So again, what happens? This is what happens, right? And you guys are doing your job, okay? I'm just telling you a cause and effect here. There's a headline: DeWitt Wegmans positive case. It is not rational or possible. There's no way, because we don't have artificial intelligence to be able to track every person that went into that Wegmans that day and go and call them. We don't have that. That is impossible. That's what we talk about. There's no 100% risk mitigation with COVID-19. If you leave your house, there is a chance that you can get COVID-19. All right? We're doing everything we can to make sure that chance is minimized. But then what happens is that headline's there. People are to the same, some of the, why aren't they calling everybody at the DeWitt Wegmans that day? It's impossible. We can't go investigate all that. So we figure out who had direct contact, because we know direct contact is, for the most part, how this is transmitted. So then people, see the reports, they get anxious, they get scared, they call us screaming why we're not contacting everybody, right? Well, we're going to keep talking about it the same way, and you guys are going to keep reporting what is news to the public. But the reality is unless we're coming out with a specific ask of the public, we've done our investigation, we're comfortable with it. We always side on caution. So if there's one person that is on the bubble, right? We know the bubble in sports in Central New York. If we're on the bubble here, we don't know if we're getting in or out. You're getting in a quarantine. On the bubble, you're in a quarantine. And again, if you're that person on the bubble, maybe you're not happy about that. But we're siding on the side of public health at this point.
Would you reiterate why the public should trust the health department's investigation? They're clearly educated in this. They know what they're doing. But it's up to them to decide who's a direct contact, who's not, and put out what they need to put out.
Yeah, so these are public health officials. And I mentioned this yesterday. I'll reiterate this point, because sometimes people think, well, they work for the politician, and the politician, what if they're not being honest with us and giving us information? Well, our public health department, our commissioner, Dr. Gupta, she gets a 6-year contract. And she goes through a process where I say, I want Dr. Gupta to be our doctor. She then gets vetted through the county legislature. Then there's a 6-year contract. Dr. Gupta is still a department head, but her job is the public health. I can't say to Dr. Gupta, you don't have your job if you don't do your job a certain way. Now, other people, I can say that, but not Dr. Gupta, okay? So her job is strictly public health. Sometimes the public health is at odds with what the private health sector is saying or wanting to do. There was a lot of elective surgeries being done in this community until we put a push saying don't do it anymore, and we put it in for an executive order. The private sector health is saying, I want to do elective surgeries. We didn't want them doing elective surgeries because we needed their PPE. So sometimes you even have those two conflicts within the healthcare system. Dr. Gupta and her team's sole goal is to keep the public healthy. They work directly for the people of Onondaga County.
Ryan, can I ask a couple of questions about social distancing?
Sure.
You just mentioned a problem of people joyriding on Centro.
Yep.
Can you give me a description of such an instance? How many people were we talking about? How do we know they're joyriding?
For it to be on my briefing here, Tim, it's not one example. So I don't know how many examples, but it was reported to us through Centro that they have a problem where people are taking advantage of the free bus service, and they're going on and they're not getting off. They're hanging out.
Groups of people?
I don't know if it's groups altogether or multiple people on different buses doing the same thing.
Okay.
Yeah.
And Dr. Gupta talked yesterday about what she, I think, is seeing as a spread of cases based on people not social distancing. And
Yeah.
she talked a little bit about house parties. Again, without violating anybody's privacy, is there an example of case that has been traced?
Let me give you some examples of things that are now, that we get questions on that put the public at risk and they don't even realize it, right? So play dates with kids, that puts people at risk, whether it's the adults interacting or the children interacting. I got an email about a neighborhood, right? I'm not going to pick on the sport, okay, but there is a neighborhood sporting event where adults are playing with kids, right? Mental health. People want to get outside. They want to play. There is a difference between a household, a brother and sister, like my son Jack and my daughter Maddie, shooting hoops outside. They're in the same house, right? If one of us is in a situation, we're all in a quarantine, right? And then with Jack and Maddie playing with the next door neighbor's children or playing with their friends in the neighborhood playing a sport, okay? So there's differences between your family doing things in your backyard or front yard and you doing that with everybody on the block.
And I think we all see a little bit of this as we go around town.
Yep.
We see kids shooting hoops, or we see people hanging out together. I'm just wondering, is it possible to cite a particular case where a play date led to...
Yeah, we can't in specifics talk about that right now, Tim, but we have more and more concerns of what are innocent human-to-human contacts that are just kind of being overlooked overall. And I think we're giving specific guidance. We're getting a lot of complaints about people, and this goes to the point earlier, people calling up and yelling at us about, you need to call everybody in this Wegmans and you need to do this or that. I got people, first off, how many people in that grocery store, how many kids were at the grocery store? How many of those kids needed to be there and could have been home, right? That's one of the things that, in my own family, we would love to take the kids out to get them out of the house, but you can't. You can't. You got to keep them home. And one of us goes to the grocery store, not two of us. So these are things, we hear the same thing at Lowe's and Home Depot from employees, right? And from managers saying, like, we hear you're saying this, is there any way to enforce this? The reality is there's really not. That's where we need to use common sense. It's very hard to enforce people's behavior when they're allowed to go to essential businesses. But if everybody uses common sense and we thin these things out, we thin these scenarios out, we're going to get to our curve and flatten it out faster.
Would you be able to talk about the supply chain a little bit? I know some people are still having trouble getting toilet paper, Clorox wipes, or hand sanitizer. We had a few people call in today. Would you be able to talk about that and when you think, stock might be up?
Yeah, I think overall the stock is up. We have a weekly call with our supply chain folks in food at our grocery stores. I think it's better, but you still have people, I don't want to say hoarding it, but they're buying as many as they can whenever they go, right? And so I get it, uncomfortable items that are missing in your house, that can be a mental health challenge, right, when you're out of certain items in your house. But I think overall the initial surge of demand has gone down. There's still a high demand, but our weekly call is telling us we're okay. We still got supply chains. What we've been doing is we've been going and working with other partners on toiletries and food and helping supplement some of that with our seniors and our healthcare nutrition line. We're doing that. We have some other partners that have helped the community in the past that we've reached out to on these types of items as well. So hopefully we'll get help there. But overall, it's not as bad as it was, but it's still problematic. Is because people are certainly, if they know that these items are there and they're low, they're capped, right? So maybe they're going, and then maybe their spouse or someone else in the house is going an hour later when they know, and these things are happening. And so it's always going to be stressed as long as everybody's in this situation, but it's there. People shouldn't be panicking. Our supply chain related to food and other items is there.
Ryan, the 7 confirmed cases at St. Joseph's Health are system-wide. Are you in touch with the leadership there as to if these are healthcare workers on the front lines or support staff or a combination of both, and if patients with COVID-19 are the ones spreading it?
Yeah, Andrew, so each hospital has infectious disease control teams, and these are heavily regulated, and they can go into their own plans. But certainly one of their mandates, and St. Joe's tests temperatures of employees every day before they go in, right? So do the specifics of these cases, I don't know them, right? It could be as innocent as all 7 of them came in, they tested with a fever, they went home, went and got tested, and boom, and they came in with symptoms that day. They didn't even know they had symptoms, right? So you would really, and that's something that they would have to talk about. But I think overall, right, this week we have bus drivers who can get sick. We have people who work at essential businesses who can get sick. We have people who work at nursing homes can get sick. People in nursing homes can get sick. People in independent senior living can get sick. People in hospitals can get sick. And that's our point, is everybody can get sick. So how do we mitigate this risk? And we're giving you the best practices that we know how, and are continuing to talk about them every day. And we're highlighting the very few cases of bad behavior so that people stop that. And we try to highlight the multiple cases of good behavior that our community is doing as well.
Are we aware of any hospitalized patients spreading it to a doctor or a nurse or hospital staff?
Yeah, I don't know specifics on that. They're not going to let us know. I think, again, I'm sure throughout the country and throughout the world, there's been a case or two, where that has happened, and it's been confirmed that that's what happened. But in our community, that's not what I've not heard that.
Ryan, do you know, is there a backup for the hospitals if they get to the point where COVID illnesses are depleting their staffs?
Yeah, so we would do, and the 300 plus volunteers we have in our health department, we would certainly look to backfill. In addition to that, right now, we've had discussions, early discussions, and these are hypotheticals we're dealing with, right? But part of planning is, but certainly we know that there are some healthcare professionals in our school systems that are not working right now. If we had an emergency situation in the community, could we call on them to come, nurses and medical directors from school districts? There's infrastructure here that we have that could get plugged into in the event that we needed to. We're certainly not there or anywhere close, but those are things that Dan Weirs and the emergency management directors at each hospital talk about every day.
Have any county employees tested positive for coronavirus?
Yes, I think we've had 2 cases where people tested positive. So I'm in that employer situation where we sent out information to our workforce, and the investigation happened within our departments. You quarantine who had direct contact, and just because you work in this department, we got very big departments, doesn't mean you had direct contact with somebody when they were sick.
Mayor Walsh, would you brief us on the Syracuse police status in terms of policing social distancing? How many reports have come in? How many calls were responded to? Any action that was taken?
I can't give you specific numbers, Andrew. We can follow up with that. They have been getting regular calls on businesses and individuals. The businesses where they've shown up, they've been able to get them to close down, and they've been forwarding that information to the Attorney General's office for follow-up. For individuals, it has been warnings up to this point. They haven't had to go any further than that.
Can you give us an update on the Clay warehouse construction and if the mystery tenant is still on board during the pandemic?
So we worked with the state for an exemption. There was a report that it was shut down yesterday. We got them an exemption. They can start construction again. Why do we get an exemption for that project? It is a logistics distribution center. Many of the needs that we have on supply chains throughout the community, the country, you need logistics, you need distribution. So we worked with the state to get them an exemption so they can start construction again today. I don't know what they have there. And certainly we would love to talk about who the company is going to be. So we've been very busy with our the COVID-19 situation right now. So hopefully that we'll be able to talk about that soon and maybe give some good news to the community as we're very, very inundated with this fight we're in right now.
But as of now, they're still on board, that tenant.
Oh, yeah.
Ryan, I see some red on Cayuga County. People have come to Onondaga County to be tested. Yesterday, the county leadership expressed frustration in their ability to get PPE, to get swabs, to be able to do their own testing. Are you willing to invite, you're not stopping people, but are you willing to actively invite communities where testing is deficient to come here to be tested?
I think you see that it already happens, right? So I get that map every day, and there's no coincidence when Albany County ran out of testing for a couple days that all of a sudden Albany County shows up. Or when Erie County runs out, all of a sudden we get a big splash of Erie County people showing up, right? And to my point, when it's related to funding and relevant to the census discussion we had earlier about people needing to be counted, we think we were undercounted before. That hurts us for money. We are the medical hub of central and northern New York. People choose to work in our community, and then many of these people go and live in a county next door. We don't get the benefit of having them in our population numbers, even though we're taking care of them when it comes to the public health crisis, because their doctors are affiliated with Crouse, St. Joe's, or Upstate. So, I don't have the ability to say no to anyone who comes in for a test in our community, nor would I. But all we ask is that there's the evidence. We have a testing triage site. We set it up to preserve and maintain our emergency rooms for emergencies and to make sure that our emergency rooms aren't havens for community spread with COVID-19. We do a good job. Other communities have gaps: Cayuga, Oswego, Oneida, Broome, Cortland. I think you see Erie, you see Niagara, you see Staten Island, you see the Bronx, you see Long Island, Albany. You look up north, you got St. Lawrence, you got Jefferson. We're not going to turn New Yorkers away from testing. All we've asked is that we get treated fairly when it comes to support from the state and federal government, and an acknowledgement that we're the front lines for this part of the state.
Would you be willing, though, to forge a partnership with a county leader and
Yeah,
say,
we
hey,
talked.
let's
I talked to the Cayuga County Legislative Chairwoman McNabb, and I told her, look, if you run into a scenario where you got your first responders who are running into a situation they need to get tested, you can't get tested, just call me. And that's gone on the whole time. I've talked to Tony Picenti in Oneida County, almost daily about ways that we can work together as Central New York. And, part of these conversations once we get through this is, should the Central New York counties all agree that in this next type of situation, hopefully not a pandemic, we're all doing the exact same things at the exact same times. These are all things that we're under discussions now and trying to help each other out. But certainly, I understand the frustration. The supply chain throughout the country is tough. It's getting a little bit better, but what you're seeing now is even if you get a big order of supplies, FEMA or the state can usurp your order and take your order and intercept it, and then go and do it, put it into the areas where they feel it's needed. So supply chain is a challenge, especially if you're getting into this late.
These smaller counties are competing against you. Is there a way to fight as a region for supplies with Syracuse agreeing everyone drive here for testing?
Yeah, I don't think the infrastructure is there to be a upstate New York testing site. We quasi are. 20% of our testing is outside the county. We've talked about sharing resources. Our purchasing department does purchasing for some of these counties already. And the reality is that we need more help from the feds and the state related to supply chain recognition in upstate New York. Most of these communities are at the early stages of this, and they can really get ahead of this with testing. And you can really flatten curves in some of these counties pretty quickly if you can identify the positive cases. So I think because it's so bad in downstate and the resources are so needed there, some of these upstate communities haven't gotten what they need to really flatten it right away. And so I feel their pain. We're helping where we can. We'll continue to help, and we think we really are kind of doing a lot of the work for the whole region. Certainly when it comes to in the event of ICU beds and that type of infrastructure, certainly our hospitals will be carrying the load there.
Do you have an update on Central New York doctors that might be called to go downstate or go to other regions?
Yeah, I mean, you guys, people are reporting about the VA, right? The VA is its own system, so the VA brought some nurses down to some of their other VA hospitals, I think. I read that. I think our hospitals are in conversation with the hospitals all the time. The reality is we have 277 cases. We have more people getting hospitalized. We have more people leaving. And we have more people in ICU beds. We don't really have doctors to spare. We've built up an infrastructure here that I think in the event there were some patients that went from downstate to Albany Med, if there's problems in the Capital District and they need to help, we believe that it's better to just send other people who have other ailments than COVID-19 if you're traveling. It's just, if you think about it, putting somebody in an ambulance and driving for 4 hours or 2 hours or 3 hours with COVID-19 probably isn't the best practice, but that probably will happen in some situations. But we think that the surge is going to move up from community to community, and if we have capacity, we'll certainly be able to help in that. But we've always said we need our medical professionals and our infrastructure in place and functioning for Central New Yorkers and Northern New Yorkers. And then if there's capacity, we will help out any other region in the state.
Have you had any requests yet to take patients from outside the area?
I think you're seeing, Tim, government has not requested that, but what hospitals are seeing are people from these regions calling and inquiring about, if can I come and do this surgery here or that surgery here from other parts of the state. So hospitals are receiving inquiries from patients, and there's certainly conversations with other hospitals in other parts of the state, checking in. How you doing? What kind of, the inquiries are being made, as I'm sure in various parts of the state, they're looking at various scenarios and looking at how they could potentially plug different gaps.
So we may not be very many days away before some patients come here?
I'm not saying that. I haven't been. Our hospitals are working with us, and we've asked the state if there is an official ask via government on our hospitals to work with our emergency management department, because we have a plan. And how what you're asking us to do will impact the plan for Central New York and Northern New York. So work through that chain, not just go directly to the 3 different hospitals. And that's what the 3 different hospitals want to happen as well.
Have you had any of your ventilators or other equipment usurped?
No,
What?
no, not mine, not ours. We got ours. But I think some of our other PPE orders may be in limbo, let's put it that way, that we put out. We don't know if they've been usurped yet, but they're in limbo, depending on what you have. But there's more players coming into this space each day. Tessie was here yesterday. Tessie's making the surgical plastic masks. Now we put a 30,000 mask order in. We know that we're going to get those on Friday, or I believe they start making them Friday. We'll know we'll get them next week. And so the more players that come in, especially if they're local, we feel more confident that when we put an order out, we're going to get the order. We know them. We know where they live. Other questions?
We've heard more and more about the FDA granting emergency approval to some of these fast
Yeah.
kits or
Yeah.
machines. Are we any closer to getting that technology?
We're intrigued and we're looking at it. We looked at the Abbott test kit. You know, looking at do the medical community feel confident with what the results are? B, what kind of capacity can you get and when can you get it? But certainly, and then what does it cost? But certainly, if we were able to get a large amount of tests that could tell us within moments if somebody is positive or not, we would certainly look at adjusting our strategy for how we're dealing with this. We would love that. We would love to have that opportunity.
This is my mom's favorite part of the briefing, Ryan.
Yes.
What's the good news?
Well, we love your mom, Andrew. And the good news is this. We've talked about throughout this process that different things happen in the community and you have different needs that happen. And one of the things that we're getting a lot of feedback from is, you know, when people are now going into the hospital, there's visitation rules and there's people are often, they don't want to be there. They're not there because they want to be there and they can't see their loved ones. And technology becomes a tool if you have it and a resource, but it's an impairment to be away from your family if you can't. And with kids and loved ones and with babies being born and everything, and life's still going on, there was an outreach from our hospitals, and there still is, for if you have your iPhones, that iPhone 4 or the newer models, that if you can donate them to the hospitals, they can then use them for their patients to use FaceTime to see their families and stay connected and really help with their mental health. So we received this request. It just happened that our Sheriff's Department and our Emergency Management Department had a surplus of iPhone 4 Plus. And so I want to thank our Sheriff's Department and Emergency Management Departments for giving our hospitals numerous iPhones that will go directly to patients so they can stay in touch with their loved ones and help them through this process as well. So Andrew, that's some good news.